Now, what is the fundamental difference between early breast cancer and locally advanced breast cancer? In locally advanced breast cancer, you're going to give neoadjuvant chemotherapy. So here your treatment is neoadjuvant chemotherapy followed by modified radical mastectomy, followed by adjuvant radiotherapy. So these patients are going to receive all forms of treatment. You're going to do chemotherapy, surgery, and radiotherapy. Now, MRM is usually done, but as expertise is being gained with the help of plastic surgeons, you can actually do a breast conservation surgery also. But as far as your books are concerned, as far as your exams are concerned, the correct answer would be modified radical mastectomy. Supposing say the option says breast conservation surgery, like I told you. So you will do breast conservation therapy or breast conservation surgery in which patients? Can you do it? Yes, you can do it. You will do it in stage 3A for N1 patients who have received good response to neoadjuvant chemotherapy. So let me just write this better. So breast conservation surgery or breast conservation therapy, you will use it. Supposing if the one of the options says it specifies that it is stage 3A and the patient has a good response to neoadjuvant chemotherapy. In that scenario, you might consider keeping the breast and not doing an axillary dissection. Now, supposing say the patient has N3B. So this was 3A. Supposing the patient has N3B, then you will use systemic chemotherapy plus radiotherapy. N3B is internal mammary nodes are involved. Okay, let us look at stage 4 also. I'll just discuss what stage 4 is before we go to the treatment. Stage 4 means it is metastatic CA breast. Now, the goal of treatment for all metastatic tumors is that you have to do palliation. That means you give tender loving care and whatever symptom the patient has, you treat that particular symptom only. So, the treatment of stage 4 is never ever curative. It is always palliative. Your goal is to improve the quality and improve the quantity of life. Sorry, improve only the quality of life. And if you can improve the survival. If not, just the quality of life. Now, when you're giving neoadjuvant therapy, what drugs do you give and how and when do you choose? So, the first is hormonal therapy. So, when do you choose hormonal therapy? If it is ER/PR positive, if there is bone or soft tissue mets only. Third option would be limited or asymptomatic visceral mets. Visceral mets means liver mets or maybe Bloomer shelf or Mary Joseph nodule. Then you have indications of systemic chemotherapy. Systemic chemotherapy is given in hormone negative. So ER/PR negative. If it is hormone therapy refractory, hormone therapy refractory. What do you mean by hormone therapy refractory? You've given 3 endocrine regimens and still the patient has disease. Third is symptomatic. Let me add an extra page. Symptomatic visceral mets. This means mets to the liver, which is causing jaundice. Now, supposing there is recurrence, there is local or regional recurrence, then what will you do? That means you've given neoadjuvant chemotherapy, you've done a surgery, and still the tumor recurs. Then what do you do? Now, supposing say the patient has undergone lumpectomy or wide local excision. In this scenario, you do mastectomy followed by chemo or hormonal therapy. Supposing if the patient has undergone a mastectomy, so basically you are trying to do a higher surgery. If there's a lumpectomy done, then you do a wide local excision. Supposing the patient already underwent a mastectomy, then what do? Then you will do resection of the recurrence. You will try to achieve clear margins, and then you have to do, obviously if you're going to resect the margins, there will be a defect created, so this is followed by reconstruction. Then you will give chemotherapy or hormonal therapy as indicated. Now supposing, say earlier you've done a mastectomy and you've given radiotherapy earlier, then you won't give radiotherapy again. But supposing if you've not given radiotherapy earlier, then you will give radiotherapy in this setting. In this sitting, I meant.